Hi, this is Sean Kennedy. I'm the editor-in-chief of the American Journal of Nursing, and today I'm chatting with Dr. Alexa Colgrove Curtis, who is the Assistant Dean of Graduate Nursing and Professor and Director of the MPH DNP Dual Degree Program at the University of San Francisco. Dr. Curtis is author of an article in the June issue of the American Journal of Nursing called Measurement in Nursing Research. And this focuses on the essentials regarding quantifying study effects and research outcomes. This is the fourth article in our series on clinical research, which is coordinated by the Heilbrunn Family Center for Research Nursing at Rockefeller University in New York. And the series is designed to give nurses the knowledge and skills they need to understand and participate in research in a step-by-step format. So each column focuses on a different aspect that underpins research and evidence-based practice, from research design to data interpretation. So today we're going to focus on measurement. Welcome, Alexa. I'm so happy you could join me today.
Oh, thank you, Sean. I'm happy to be here and delighted to participate in this research series for AJN. It's such a great series because we know once people get out of school, they tend not to go buy a research textbook. So I think having this, article these series of articles rather that focus on each particular step in the research process is much more doable and more appealing for nurses who are out in practice. So I'm just very pleased with the series. So before we get into the article per se, could you talk a little bit about your current role, what you do, and your connection to research? Sure. So as you mentioned already, I'm the Assistant Dean for Graduate Nursing at the University of San Francisco. So in our university, we have a DNP program. So I do teach the data analysis class in the DNP program, as well as work with DNP students in the development and implementation and evaluation of their project. Mm-hmm. And then in my own world, as a academic and a nurse academic, I completed the PhD program at the University of California at San Francisco in both the quantitative, which we'll be talking about today, and the qualitative tracks. And later in the research series, we talk about qualitative analysis. And my area of interest has always been, I actually live in a rural community in Northern California, above Sacramento. So my interest has always been rural health, access to health services for underserved populations in rural communities, and most recently have done a strong pivot to treatment of substance use disorders, particularly opioid use disorder, as well as workforce development around opioid use disorder. That's what I do.
Wow, that's interesting. It's certainly with COVID, one hears of the increase in opioid use disorders because of the clinic and just the whole atmosphere and stress that it's caused. Are you seeing that in your area?
Yes, absolutely. The relapses, the overdoses have really spiked. It's been a stressful time for everybody, but particularly those who were already handling multiple stressors. So, yeah. Absolutely.
Yeah, we all have our work cut out for us, I think, going forward for the next year or two at least. Yeah. So, well, getting back to your article, this particular article, as you said, focuses on the quantitative research and covers, I'm amazed at how much you covered in this short article. Level of measurement errors, and also the very important concepts of validity and reliability. In your experience working with novice researchers and your students, what seems to be the most troublesome aspect when they get to this point in designing their study?
Yeah, I think unnecessary fear of measurement is the most troublesome aspect. When we think about it, really nurses are natural at measurement.
we do measurement all the time. And I think, as I said, I teach the data analysis class, and I cover this material in my class. When it's presented to you in a textbook with a lot of maybe new language around it, it seems so frightening and obtuse, when it's really quite simple to nurses. As I said, nurses are measuring things all the time. They measure, for simple things, they measure blood oxygenation, they, measure weight, and they are thinking constantly about measuring less simple things like concepts, around stress. So really, the first step is to really demystify these concepts, all the research concepts. And I think that's what the AJN series does so well, is it breaks it down, demystifies these concepts, and puts them into context that nurses can sit back and go, oh, yeah, I already do this. I do a lot of assessments using measurement tools that are already embedded in my clinical practice.
Well, I liked what especially appealing to me as a non-researcher is the examples, the real world examples. So when you present a concept and then you say, for example, and you ground it in, a clinical setting or a clinical problem, which nurses can really relate to, so they can, really apply it to their own world. And I think that's so helpful.
Right. Yes, absolutely. And, and the other thing you say, what's the biggest hurdle? I wouldn't say this is a hurdle, but it's always the starting point when we talk about measurement, is how do we measure a concept? And moving from more of the abstract conceptual definition of something like the experience of stress, which we were already talking about with the opioid use disorder, and then how do we move that to an operational understanding of stress? How can we measure and define stress in a quantitative way that provides us some data to make some associations at the end of our investigation?
Do you think, it seems to me, and maybe it's just the type of submissions we get, is a nurses more likely to be doing quantitative research versus qualitative?
That's a really great question. I would say that most of the nurses, when they come out of whatever formal education they have more formal education in quantitative methodologies. So I think they have more familiarity with measuring things based on numbers rather than the narrative. But then what I see happen is, unnecessarily, the nurses get afraid of doing their statistical analysis. And so they move away from the quantitative research and start to move toward the qualitative research, where they gather narrative text and, define some outcomes based on the narrative text, because they're steering away from doing the statistical analysis. And that's what we also, hope as we move through this series, is to allay some of those fears around doing some, very basic statistics that, our graduates can certainly do. And if they can't, they can always find someone to help them do the statistics. And that's another really important thing, is nurses are experts. Nurses are experts in nursing care. Nurses are experts in humanity. Nurses are experts in psychological and physical processes. Nurses don't necessarily need to be expert statisticians. We can hire people to do that.
Right. That's a great point, because we tend to feel sometimes that we have to do it all. And you're right, we don't really need to do that. We can go to a statistician. And actually, when we have research papers in AJN, we do have several statisticians who do review that part of the paper, because we all feel that, you need another pair of eyes on it. We have our PhD reviewers, but again, many of them have done research and, as yourself, teach research, but having the statistics, having a real statistician who's from the math department makes us feel a little bit better. And I think it's a great point that we don't have to do everything ourselves. And
Right.
I think that's a great point.
Yeah, absolutely. And remembering how important nurses are to this research project, because the statistician does not understand what's going on in the care of our populations in whatever setting we are. And we bring that really valuable situated knowledge forward that can inform practices and take that to the statistician to help us measure.
That's a great point. Yeah. So one of the and I guess it's towards the end of your paper, and it's a quote because I just really liked it, and thought it really kind of summed up a lot of what we're trying to do. And what you say is evaluation of a research study prior to practice implementation should include assessment of the validity and reliability of the measurement instrument employed, which should be described within the research article. And I really like that because I think, at least in many of the submissions that we see, that piece seems to be missing, and or people develop their own, especially in evidence-based project and QI studies. We see people developing their own instruments, and there's no indication that they were tested for reliability and validity. So I think that's what people call the down and dirty research tool. So I think that's a very good point in terms of the measurement aspect of it.
Yes, absolutely. Whenever we read our research articles, and certainly whenever we go to implement them, we need to sit back and ask ourselves, so how are these concepts that they're talking about defined? And do we agree with how they were defined? We are experts, we are nurses. Do we agree? Just because it's written there in a research article with a lot of numbers around it doesn't necessarily mean that we agree with the concept. And then do we agree? Let's look at the measurement tool, whether it's a biometric measurement tool, whether it's a survey measurement tool. Let's look at the measurement tool and see if we agree that that's a good way to measure that concept.
Right.
And then if whatever measurement tool they used, was there some formal evaluation of validity and reliability done? If it wasn't, that can be okay, as long as you've looked at the instrument and feel conceptually and statistically that you agree with it. But then that instrument should be moved forward. The recommendation would be that future testing for reliability and validity should happen around that validity, around that instrument.
Right. So you would expect that in the limitations section or for future research sections.
Right. And we definitely expect that, in our DNP projects, that the DNP student implementing the project has really looked critically at the instrument.
Okay.
And then when you're talking about looking at the validity of the instrument, we are doing a future, the next article that I am personally working on is looking at sensitivity and specificity of different measurement tools and, how, basically how accurate they are. So the readers can look forward to that one as well.
I will too. I will too. This is as I said before, this is a nice refresher for me as well. So I really do appreciate the series, and especially the more technical aspects of the measurement and the tools. So it was great speaking with you, Alexa, and I look forward to the next article, and we can have another chat about that one.
I look forward to it, and I certainly hope to hear back from the readers about the work they're doing in the area of research, whether they're individual research or team research or thoughts that they have on research. We sure would love some feedback.